Hello guys, welcome back to Anatomy and Pathology. Today we will be talking about arthritis. We will be looking at two common types that you may see in practice, and hopefully by the end of this video you'll be able to easily distinguish between these two arthritic types. So what is arthritis? The textbook definition for this disease process is a condition whereby there is swelling or tenderness in one or more joints. Different forms of arthritis will affect the bones and joints in different ways. Let's move on to the two that we'll be exploring today and their radiographic features. Today we will be looking at osteoarthritis, which is commonly referred to as OA, and also rheumatoid arthritis, which is known as RA. So when looking at OA, there are many radiographic clues that help us identify it on a radiograph. Here we have an AP pelvis radiograph which demonstrates characteristic features of OA. OA is a degenerative arthritic process. This type of arthritis is caused by gradual breakdown of cartilage between the joints, and this is generally deemed as wear and tear of the joint that is being affected. OA will present with asymmetric joint space narrowing. We can see here that the right acetabular joint space has become narrow in comparison to the left side, which is more preserved in nature. Our next radiographic feature that we will be looking at is subchondral sclerosis. Subchondral sclerosis is when the bone becomes thickened and hardened underneath the cartilage in a joint. Due to these changes, it appears as these white areas that we can see on the affected hip. This is a characteristic appearance of classic OA. Next, we will move on to osteophyte formation. Osteophytes is a fancy term for bone spurs. Osteophytes are bony growths which occur due to our bodies trying to repair the damage by creating new bone in and around the affected joints. They will usually be painless and will not need to be treated. Now, as well as subchondral sclerosis, you may also notice subchondral cyst formation on a radiograph demonstrating OA. These are fluid-filled sacs inside the joint that will extend out from one of the joint-forming bones. We can see an example here just superiorly to the right femoral joint. Now let's take a look at rheumatoid arthritis. Here we have a radiograph of bilateral hands to show how this arthritic process will usually present. It is firstly important to note that rheumatoid arthritis is an inflammatory arthritic process. This means it is caused by the body's immune system to mistakenly attack healthy tissue, causing inflammation at the site. Unlike OA, rheumatoid arthritis will represent symmetric joint space narrowing. Because of this, clinicians will usually ask for bilateral x-rays, as we can see here. If we look at both the left and the right hand, we can see symmetric narrowings of the distal interphalangeal joints. This is again a characteristic feature that will help us distinguish RA from OA. The next feature that we'll be looking at is soft tissue swelling. We can see generalized soft tissue swelling around both hands, although it is not severe, and on this radiograph we would probably deem it as minimal soft tissue swelling. This is usually a key differential between OA and RA. Our final RA feature is juxta-articular osteoporosis. Osteoporosis is a term used to describe demineralized bone. RA is one of the only arthritic changes that will demonstrate osteoporosis. On this radiograph, we can see lytic appearances of darkness on both hands. This means that these areas of bone are demineralized in comparison to the other areas which are more white. Thank you for watching this video. I hope you were able to learn a lot about OA and RA through this video. Don't forget to like, subscribe and comment. Please leave comment on other topics that you would like us to cover, and see you in the next video.